Great, we are back. Thank you for the patience, and we finally worked this out. I'm excited for our next two speakers, Dr. Anand and Mr. Wilson Du, who I heard his name a lot. And Dr. Anand is the medical director for the Center of Tubular Disease at the Stanford University. She's engaged many clinical research focused on kidney disease living in low resource setting using practical tools. Mr. Wilson Du has been on dialysis since 2016. At the time of diagnosis, he was over 315 pounds and wasn't giving much hope to survive. Then he chose life, and step by step, he walked and changing habit. Never give up. I'm looking forward to a wonderful, wonderful talk. Thank you.
Thank you, Cisse. I hope people can hear me. Thank you so much, Cisse. It's been such a privilege to be here to listen to all the prestigious roster of people who have been sharing their expertise today, and just a privilege to be able to share the participants' time as well. Thank you, everyone. So I am going to share, I have a fantastic partner today. My talk is a shared talk with Wilson Du, who is also known as the Renal Warrior. And I'm not going to try to steal much of his sunshine. You know, he brings a lot of energy and motivation to his devotion to fitness. And I just want to back him up and provide him a frame for his talk today. Next slide. So we don't have disclosures. Next slide. So, you know, I think we started the day today literally talking about how telehealth had a start in rocket science, essentially. And I just want to say that fitness is not rocket science, right? I mean, we are not talking about things that are complicated here. We pretty much know how to improve fitness. We know that we have to enter this positive loop of eating right, exercising, and trying to maintain weight. But I know that many of us are in a negative loop instead, and I share that challenge as well, where we have such a hard time getting into the positive cycle, but rather are working in reverse against ourselves. And I'll let Wilson start talking about how he spent a lot of his life pre-kidney disease diagnosis in a negative.
All right. Again, it's an honor and a pleasure to be here with everybody. Thank you, Dr. Shuchi and Anand. Really appreciate that. But I'll go ahead and get started and just explain a little bit of where it kind of all started. You know, I always was a big guy growing up. You were looking at, I was a football player, I was a lineman. And was always somewhat, I was a big guy, but I was always somewhat active. So I kind of kept that, kind of stayed in shape. But after my senior year in high school, the training stopped, wanted to enjoy my last senior year in high school, and, just kind of stopped exercising and just packed on a little bit of weight. But I kept on telling myself it was okay, because one of these days when I started college, I was going to shape up. I have a little bit more time for that. College came, and, I'm exploring the new world. I'm exploring my new life. A lot of people talk about the freshman 15. I probably gained like the freshman 50. I just eating everything and just enjoying myself. But I always told myself it's okay, because one of these days after college, when I start working, I become an adult, I was going to be able to shape up and start doing things and really just get back in shape. Well, I became that adult and started working. And I got into real estate and finance. And, at the time the market was booming, and I kept on making an excuse. When I close this deal, that's when I'll start shaping up. One of these days when I close that deal. But then one deal after this deal closed, another deal came in, and another deal came in. Kept on telling myself one of these days, until one of these days kind of caught up to me. Started getting some things. It was gout. I never really went to go see the doctor, because I kind of knew what they were going to say. They were going to say you need to get on a diet and all that stuff like that. And one day, one of these days, I woke up and I had gout on my ankles and my knees. I couldn't get out of bed. The only thing I could reach for was the phone. And the first thing I did was got on the phone, called 911. They came and got me, brought me to the ER. And that's how everything, my life just kind of changed from that day. So, Doctor?
Thanks, Wilson. So yeah, actually, next slide, Jessica, to the data slide. So I just wanted to show that, you know, this is the positive loop that we were talking about and how we were in the negative loop, and Wilson was in the negative loop at this prior to starting dialysis even. And next slide. And, you know, again, reinforcing that poor health in terms of low physical activity, sedentary lifestyle, imperfect nutrition, and higher weight, we know downstream leads to physical pain and physical dysfunction, leads to diabetes and other metabolic disorders, and then in the end can lead to kidney disease in a majority of our patients. And in us as people who are caring for people, but also don't have time to care for ourselves. Next, if you could hit next, Emma. So I think you should be seeing a data slide that shows that the risk for end-stage kidney disease, these are data from the National Health and Nutrition and Examination Survey linked to the USRDS, which show that in people who self-reported being inactive, the risk for end-stage kidney disease is twofold higher than people who have even some activity or moderate activity. So just data to back up the fact that, you know, poor physical activity leads to higher risk for end-stage kidney disease. Next slide. So the thing that we sort of need to think about is sort of flipping the paradigm. So we know that inactivity and poor diet and nutrition lead to a host of diseases, including kidney disease. But often we're dealing with someone who has kidney disease, like Wilson. So now we are in the stage of kidney disease. Now what can we do? And does fitness still matter? And the answer is yes, it still matters. Next slide. So these are data from the VA study that show that were exercise data among men and linked exercise activity on an exercise stress test to survival. And you can see that despite the message here is that, you know, people who are normal, who do not have heart disease, benefit from being able to achieve better METs, and people who have cardiovascular disease, so they've had a heart attack or a stroke, they also benefit. They also add years to their lifespan if they are able to achieve better exercise capability. And so here on this lowest end of the curve is less than 5 METs, which is basically like the ability to do housework. And if you go to the next level up, which is just 5 to 8 METs, that's the ability to jog or run jog for less than 10 minutes, but have a brisk walk in total that is about 4 miles an hour. So not a huge amount of activity increase, activity capacity increase, and you actually literally add years to life. Next slide. So you should be seeing that there is an increase in physical activity there's an increase in lifespan by about 3 years in people who were able to achieve the METs of 5 to 8 METs versus in people who have pre-existing cardiovascular disease, the lifespan addition is very, very similar at 2.5 years. So next slide should be talking about kidney disease and risk for mortality with kidney disease. And so this slide shows data from the NHANES again, so the National Health and Nutrition Survey again, and it shows that people who don't have kidney disease, so the hazard ratio that is shown there is reduction in mortality, so lower risk for death. So the lower that number, the better. And you can see that people without kidney disease, if they have some activity or are meeting activity levels, are having lower risk for mortality, and people with kidney disease, so the eGFR cutoff below 60, are also benefiting with exercise. And I just wanted to compare that to things that we spend a lot of time as practitioners talking to our patients about, which is one of them should be phosphorus on the right side. And you can see, I mean, these are not perfect comparisons, but you can see that with an increase in dietary phosphorus, there isn't a higher risk for mortality. And, you know, we spend a lot of time talking to our patients about phosphorus, but, you know, it's really hard to really track the benefit to our patients in really restricting phosphorus. And similarly, if you look at blood pressure data, there is benefit to strictly controlling blood pressure, but the scale or the amount is probably similar or maybe less than if we just got our patients up and moving. Just, you know, this is not a perfect comparison, but just to put into perspective that activity has at least as much or more benefit than some of the other things that we end up focusing a lot of our clinical time on in terms of talking to our patients. Next slide. So the next slide should be patients who are on dialysis and survival in patients who are dialysis. So people who are in the low level of physical activity compared to people who are just meeting the average levels of physical activity. And again, you can see that meeting the average levels increases lifespan in patients on dialysis. And if you look at people with kidney transplant, the effect there is amazing. So the people who are are reporting being active with a kidney transplant, you know, at 5 years have less than a 5% chance of having, you know, died, versus people who are inactive, about 15 to 18% of them that died in this study at the end of their 5 years. So, you know, across the whole range of kidney disease, exercise is making a difference. The next slide, I think we can just talk briefly about. This is about looking at kidney disease in progression and exercise and changing the progression of kidney disease. And you can see there that their data are more mixed. So in this study, the first study is from Crick, and you can, the data, they looked at multiple lifestyle factors and looking at progression of kidney disease, and didn't really find a consistent signal across anything except smoking. So physical activity did not seem to have a signal in their study in terms of reducing risk for progression of kidney disease. But another study published in the JAMA Internal Medicine did find a difference. This was from a cardiovascular health study, CHS, where they looked at whether people who were active were more or less likely to have rapid kidney function decline. And they found a signal that people who were more active were less likely to have rapid kidney function decline. So, I mean, the data there are more mixed, but I think the bigger picture is survival, right? And survival is definitely better in people who are active. So just as a summary, that the next slide should be a summary slide that shows that, that, you know, exercise reduces incident kidney disease, but also death also allows our patients to live longer just if they have kidney disease, if they have a kidney transplant or are on dialysis. So I'll let Wilson talk next about how when he was starting dialysis, how his body was changing and reacting.
Yeah, so I mean, right there, I left off earlier at going to the ER. Now, at this time, I kept on telling myself one of these days, and just like Dr. Anand was talking about how being overweight can contribute to a faster progression of kidney disease. At the time, I knew I was a big guy. I never went to go see the doctor because I knew what they were going to tell me. Every time I went, I knew they were just going to say, you need to lose some weight. You can't live like you're 25 again. You can't party like you did before. You just got to go on a diet. That's why I never went to go see them. But that day, I had to go see them. Ambulance came and picked me up, called the ER. I couldn't move, gout on my ankles and my knees. Went to the ER, and I remember specifically going in there. My blood pressure was somewhere around 240 over 160, something to that effect. The ER doctor did come in and said, Wilson, it is gout in your ankles, your knees. We're going to give you a cortisone shot. By the way, you also have stage 5 end-stage renal disease. Did you know that you had kidney disease? I don't see it in your chart. I go, don't worry about it. It's all good. Just give me a pill, surgery, whatever. Fix it. I need to be on my merry way. I need to start work again. And the doctor's like, no, we cannot in good conscience let you leave the hospital tonight. You need to stay here, and a nephrologist will come in the next day to talk to you. I remember the nephrologist coming in and just letting me know, look, this is what's going on. You have kidney failure. This is what's going to happen. I go, no, doc. You need to just hurry this thing up. I don't have time for this. I know I need to go on a diet. I promise I'll start eating well. He's like, no, Wilson, you don't understand. Your life is about to change. You're going to start something called dialysis. So I was like, there's got to be something else. Like, he explained to me what dialysis was, and it was just, He said, well, the other ways you can get a transplant. But unfortunately, you're not going to be able to qualify for a transplant. I put it off for so long. I kept on telling myself, one of these days, I was 34 years old. I've been telling myself one of these days since I was 16 or 17 years old, almost 20 years. At the time of diagnosis, I was 315 pounds, completely unhealthy, not exercising, blood pressure through the roof. Long story short, a couple of months later, I swelled up. Kidneys completely failed. We were looking at about 60 to 70 pounds within a 2-week period. One day I came home, I collapsed. Couldn't get up. Again, called 911, brought me to the hospital. And that day was when I started dialysis. I remember being in the ER, swelled up 60, 70 pounds. The doctor said that my back had given out because I gained so much weight so quick. It was a painful moment for me, my family, just everybody. I didn't know what was going to happen. Going through dialysis that night, I had gout from head to toe for some reason through getting dialyzed. After getting a catheter in my heart, dialyzed, gout went on my neck, my back, my fingers, my ankles, my knees, everywhere. Doc came in and said, look, it looks like you're extremely sick. Just I was in the hospital and a nursing home for about 6 or 7 weeks total before I got out. My only life was, after that time, they would take I would get an ambulance transport over to dialysis clinic back home, and they would tell me, do you want the couch or do you want the wheelchair? I couldn't walk. All my muscles atrophied for staying in just all the gout inflammation made me just lay in bed in the hospital, in the nursing home, 6-7 weeks, didn't really move. That wasn't the only pain. My life turned upside down that day. But one of the biggest pains was watching my family see me go through all of this. Emotionally, it was horrible. having my mom, my aunt, people I care about sit right next to me in my hospital bed, just smiling, telling me that everything's going to be fine, only to go into the other room and just cry their eyes out, and I could hear that. I was completely broken, emotionally, physically, spiritually. I couldn't move. I was completely, ever since I was 18 years old, I was completely independent. And here I am, completely dependent. Couldn't go to the bathroom by myself, couldn't take a shower by myself, couldn't eat by myself, couldn't even cheat on the foods that I wanted to eat. I had to move back home with my folks. My mom had to take care of me. I started thinking a whole lot about not surviving. I was thinking a whole lot about, if I left this earth, would I have left it a better place? And at that moment the answer was no. And I had a decision to make. Either give up or choose life. Dr. Anand, take it from there.
Yes. So wasn't that, it's just so touching. You make it so real. But I just also wanted to show data again to back up Wilson's story. So at slide 13, you can see that this is a study that looked at patients who were starting dialysis in the US. So this was a sample that was highly representative of all patients that were starting dialysis. And the left, sort of the first boxes show you the activity level of an average person. And then the right boxes show you the levels of a patient starting dialysis. And again, even across all age groups, even people who are less than 40, like Wilson, they are less active. They have less physical capacity. Next. And so the bottom line from this study, which I took away, was that less than half of patients could walk a mile when they started dialysis, and a majority could not walk a mile. 80% could not walk a mile when they started dialysis in the US. And there are multiple reasons for that. Some of them we've talked about, in that some of the patients have diseases that are a result of some of these poor lifestyle choices, but also that dialysis itself adds to physical incapacity. So next slide. So here, this should show you, slide 14 should show you the muscle fibers of people actually from a rat. So on the left side is a normal rat, and then on the right side are muscle fibers that are cross-sectioned from the quadriceps of a rat that has had a 5/6 nephrectomy. So they've been induced to have kidney failure. And just 2 weeks after they had this kidney failure induced, you can see their muscle fibers have shrunken. And we don't actually know why people who have, quote, uremia, so end-stage kidney disease and symptoms related to end-stage kidney disease, start to develop this type of muscle atrophy, but it's visible in multiple studies. Next. And you can see here, these are some of the symptoms of uremia, and some of them, like anorexia or loss of appetite, also feed into the muscle loss that we see in our patients on dialysis. But multitude of them, basically every symptom that you can read on this list adds to physical incapacity. Slide 15 should show you the dropping physical capacity of patients along the axis of kidney failure. And so people who start out having kidney disease, even mild, have lower capacity than people without kidney disease. But that really dramatically shifts downwards as people reach dialysis. And this is physical capacity that's measured in a very objective way using VO2 max studies. And then it starts to rise somewhat when people get a kidney transplant, but does not return to normal. And so I guess so slide 16 again goes back to that loop, and just makes the point that Wilson already made, that when someone is already in a negative loop, having kidney failure just makes it that much harder to get out of that loop and to get into a positive and to flip it into a positive way. And then I just hopefully Wilson can now talk about how he made that change personally and what really made the difference for him to choose life and you know, flip that.
All right. Well, here we go. So I was just talking about, you know, so much pain, everything, just, you know, again, being completely broken and really contemplating about, do I give up? I even looked up what would happen if I stopped dialysis. And it said that a person that would stop dialysis would go peacefully. And that was definitely an option. And being completely dependent, not knowing if I was going to survive, a simple Google search to see an average lifespan of a person on dialysis, it said 3 to 5 years. And I was thinking that was it. But I had a choice to make: either stop dialysis and stop being a burden on my family and the people that I care about, or do I go the other direction, which is choosing life? And that day, I remember one day coming back from dialysis, transport put me in the wheelchair, I was looking outside. It's a nice day, on the wheelchair, looking out. And I asked myself, what decision are you going to make? Either choose to end it or choose to fight it. And it was at that moment, that definitive moment, where I said, I choose life. I'm going to fight this thing tooth and nail. It didn't matter if it was going to kill me, because I was already dead in my mind. So I'm going to choose to fight this as much as I can. Everything just started rolling back in my mind, how my family felt, the burden that they felt, the pain that they felt. It wasn't fair if I had given up. Let's go ahead and fight this. I owe it to them. I owe it to the people that I care about. I asked myself, would I leave this earth a better place? At that moment, the answer was no, I wouldn't have. So I have more to live for. I have more things to do. And I promised myself that if I were to get out of this, I promised that I would do everything I can to help as other patients as well, so they're not feeling the same thing. So I chose to fight, and I chose life. And from that day, I got up off that wheelchair. It was painful as heck, but I got up and step by step by step, I walked to the front door, about 10 feet. I came back in the house and I slept the rest of the day. But then the next day, I did that again. To the door, to the wheelchair, to the door, to the wheelchair. Did that every single day, then multiple times a day. Just kept on doing it and doing it and doing it and doing it. I got a little bit stronger. So that front door turned into front of the house, to the porch. After to the porch, it was down the sidewalk. I did that every single day, day in, day out, day in, day out. Went back to the house, slept some more. Down the sidewalk, we came down the block, went to the mall. I had my mom following me. She was pushing the wheelchair just in case I needed it. I had crutches, I had a cane. I kept on going and going and going. I never stopped. I remember when I did my first mile, I had that documented. It took me 45 minutes to get my first mile, but I didn't care. I felt like the king of the world. I just kept on going and going and going. And after I did that first mile, one day I said, you know what, let's go ahead and let's just try and jog a little bit. So 1 minute jog, 2 minute jog, 3 minute jog, kept on going and going and going until I just kept on jogging mile after mile. Then I started running 10K, 5Ks, a half marathon. And then I introduced the diet. The weight started coming off. I'm like, oh my gosh. I wasn't looking at a long-term goal. I was just looking for the moment. I was looking for the win right now. Today, I had to run a mile. That's all that mattered, was that mile, nothing else. The weight, I didn't care about. I just kept on looking at it week after week after week. And then after I started jogging, started running these races, let's do something else. Let's try something else. Let's get on a bike. Hopped on a bike, 5 miles, 10 miles, 15 miles. And then one day I said, let's go ahead and try to do something grand. So I took the bike, went from Ontario, California, all the way to Palm Springs, which was an 80-mile ride. And from that day on, I was like, that's it. I can do this. I can keep on doing this. And then what I did was I took my bike further along down the year, and rode my bike from San Francisco Bay Area all the way down to San Diego just to prove to everyone that even though you're still on dialysis, you can still make it happen. You can still move mountains in face of adversity. And I still wasn't done yet, because after that, now a year later, did Oakland, in Oakland, California, did an Olympic distance triathlon. And guess who was there to greet me at the finish line? Was National Kidney Foundation, Patty McCormick. And I remember coming out and tears were just rolling down all of our faces. That last quarter mile, I tell you, every single pain that I went through, every single emotional pain, every single physical pain was going through my mind. And I was just thinking, just a few years back, I couldn't even walk. I didn't even think I was going to survive. And here I am finishing an Olympic distance triathlon, going a little over a mile swim, hopping on a bike right after that, 25-mile bike ride, hopping off the bike right after that, and doing a 6-mile run. I was almost last place, but I didn't care. I finished it. And I finished it for all the other patients that were going to go through this. I finished it for my mom. I finished it for my dad. I finished it for my family. And that is that's how I overcame it. And all of that is just, I never stopped. I just kept on going and going and going. So, Dr. Anand, take it from there.
It's hard to take it from there. It's hard to take it from there.
You know, it's a crazy journey. So, yeah.
It's an amazing. Yeah, it is. It's an amazing journey, but I guess the main point that Wilson makes is that to enter the positive loop, you can overcome kidney disease, and it is the power of the mind and helping yourself overcome all the barriers that we ourselves place on fitness. So if we look at slide 18, so Wilson did this pretty much on his own. He was motivated on his own. He did not participate in any formal programs, but there are programs that have been tried in people to help them increase physical activity. So if we look at slide 18, you can see this was one of the most sort of classic programs. That's probably the largest study of exercise still conducted. It was published in 2000, looking at introducing people who were on dialysis, giving them cycles, sort of stationary bikes to work on while on dialysis. And so this was a 286 people study, and they did 8 weeks of a home exercise program and then 8 weeks of exercise that was supervised by the dialysis nurses in the center with these stationary bikes. And there were some logistical challenges and there was significant loss to follow-up. But you can see that, but there was also moderate gain in ability to exercise in the people who participated in the exercise program versus people who were in the control arm. Now, I think this study has not yet been scaled on. I mean, it was published almost 20 years ago, but it hasn't been something that's been scaled up. I saw when I was preparing for this talk that there are multiple places trying to bring this into their dialysis units, and some places do offer it, but it's not something that is consistently being offered. And I think other people who are listening and who have had maybe experience with this can talk more, but I think it's really the logistical challenges of bringing a stationary bike and asking a dialysis nurse who's already busy to try to help a patient get on this bike during dialysis. There is an ongoing study in the UK, which is a larger study called a PEDAL study. So if you hit the next button, Emma, you should see that that it is ongoing. It's a multi-center study where it's called PEDAL, where they're going to try to do this again in a randomized control way and see if it works and show the effectiveness, hopefully, of this programming, and that can increase uptake, hopefully. Slide 19. So here, this is a exercise programming that was tried in patients who had kidney disease, stage 3 or 4 kidney disease, not yet on dialysis, and they were referred to like either rehab centers or exercise gyms, and had like sort of a supervised exercise program for 12 weeks. This program, one of the main, again, they had modest improvements in physical activity measures like gait speed and 6-minute walk test. And if you hit the next button, you should see that. But also the amazing part of this study, even though it was small, was that there was very little loss to follow-up, about 19 to 20% only, which was a fantastic achievement. But again, this has not been, so this was called a renal rehabilitation program, which as people who may be working across disciplines know that these kinds of programs exist for other diseases as well, but it doesn't, it's not been something that's been scaled up. Next slide. So this is slide 20, should show you a program that's actually occurring in the Bay Area among patients on PD who have not been ones to get much attention related to exercise. And this is a study showing feasibility of using resistance bands in a supervised setting in patients on PD. And again, the study is small and they haven't looked at efficacy yet, but the main point here was that they were able to get people who they randomized to be following the program and not be lost to follow-up, essentially. And so that's a fantastic start to the study, and hopefully we will get more results from this as it progresses. Next is slide 21 is our work looking at what's called the Exercise is Medicine in CKD initiative. And the Exercise is Medicine is so that's a great catchphrase, exercise is medicine. And I hope some of the data that we showed you before in Wilson's story really, brings that phrase to life. But this was a study that we did in Stanford and at Emory, trying to reach diverse populations and getting them in pre-dialysis kidney disease and randomizing them to physical activity interventions, 2 types of physical activity interventions. So at slide 22, you can see that the 2 interventions were either people were given sort of a fitness tracker and contact with a fitness professional over the phone to help them help encourage physical activity, or they were given the fitness tracker with the contact with the fitness instructor plus a small group exercise training for about 8 weeks. So next slide, 23, shows where we did this. We sort of integrated into the Timpani Center across from the Santa Clara Valley, which is not quite the traditional gym, not quite as intimidating. It serves as a physical rehab facility as well, and had like a lower foot traffic and a foot traffic that was more devoted to people with chronic conditions. And we had a fantastic fitness trainer work with our patients who participated. Slide 24. You can see some of the pictures of the types of activities that they were doing. These were very small groups, but there was still camaraderie among the people who came to participate, and they were themselves very amazed at the things that they were able to accomplish. And they started out very slow, and over the course of 8 weeks, were feeling comfortable around the gym and able to do some resistance training as well as aerobics. Next slide. So slide 25 just shows you that there was modest effect. The effectiveness of the intervention was that people seem to have maintained average step activity in the people who got the 8 weeks of group programming versus people who didn't actually just steadily lost activity over time. And so they maintained average distance and they maintained average steps over time better. But then next slide, 26, you can see, so we contacted 228 people, just like with the depression study you were hearing about. We contacted a lot of people, and many of them, some of them were ineligible for some reasons because of age cutoffs, et cetera, but many of them just did not want to participate. So that was our main barrier to enrollment. And even though we were able to randomize 64 people, which actually in the CKD exercise world is pretty big number study. we didn't get as much follow-up as we were hoping. And so only about half of our patients who were randomized to the group sessions made it for our final follow-up. So next slide, slide 27. So, I think the bottom line from the programming that's offered in the community or has been tested in the community and across the range of people with kidney disease is that it works modestly. I don't think we need to spend a lot of time thinking about whether or not it works. We just need to figure out how to get it to patients and how to get patients to come and adhere. And that's really the challenge. In our study, for example, the challenge was around hospitalization. So we lost people when people were hospitalized and then they didn't feel strong enough. They didn't have that internal motivation to come back into the group. So, finding what are the barriers to continual engagement is, I think, the holy grail for kidney disease and exercise programming. And then working towards sustainability. Even in our small study, we saw that people who were in this, while they were in the group programming, they did maintain their activity, but then again, they lost it as soon as we stopped. And so sustainability and adherence is what we require in order to get scale, right? If we can show that people are going to come and they're going to stick around, then we can get to go to policymakers and insurance companies and say, give us funding for this program. And so that's what's really required to support our patients. Despite these challenges, I just wanted to end on a positive note because the patients who did participate in the study, they noticed differences in their everyday lives, in their everyday interactions with their clinicians on how just a little bit of exercise 2 times a week really revolutionized their life. And Emma, if you don't mind going to the next slide, 28, and just playing the first video for about a minute. Doesn't sound like we can hear, right?
No, I don't.
Okay, so we'll let Wilson wrap up. Sorry about that, guys. But basically, the participants just really told us about how they really, like, just the small differences in being able to climb a flight of stairs and carry their own groceries upstairs were life-changing for them, and how that is hopefully what's going to motivate them to continue to participate in exercise. Then I'll let Wilson finish up.
Yeah, so I mean, I can't echo that sentiment enough. Is that there's so much benefits to exercise, not only the physical aspect of it, but the just mentally and being able to build confidence to be able to do more. Are we able to play the video I had, or probably no sound either? So, okay, well.
We're going to give it a try for you.
Okay.
Just give us 1 second.
All right, take your time. this video is it showed my transformation, as well as it was my first major bike ride, going 80 miles. Didn't think it was possible, but definitely, hashtag nothing is impossible has been in my life for the past couple of years, with a lot of posts that we post up. So hopefully the video works, but if not, okay.
That was wonderful. Well done. Thank you, Wilson and Shuchi. While we're waiting for this, I really, really impressed and very touched by your story.
I guess while we're waiting for the video also is that, once I started losing the weight, once I started competing and everything, that was really when Renal Warrior was created. One of the biggest things for me was that I still remember sitting in the nurse's office when she was telling me to choose between PD and hemodialysis, putting the fistula in my arm or putting the catheter in my stomach. I was sitting there, a grown man, just crying and going, "What are you talking about? You're telling me to do this." And I was looking online, Google, Facebook, social media, who's on dialysis or who has kidney failure that's lost the weight, and I could not find anybody. Everybody that I found was just post-transplant. They've already gotten, they're doing something. And I could not find that hero, because once I found them, I said I would do the exact same thing as they did. And that's why the Renal Warrior was created, so that next time somebody else is diagnosed in the exact same position, that they're searching on Google, Facebook, social media, wherever, they'll find the Renal Warrior and they'll see what I've done. And they can even call me. They can even stop by and come see me. I've had some people come do that. So go ahead.
Go ahead.
But I was just, that was my main purpose. And going back to earlier when I was saying that when I didn't think I was going to survive, and you start thinking about your life and thinking about if you died, would you leave this earth a better place? And at that moment, I said no. And I said that if I was praying and I was just saying, please, if I can get out of this, if there's any way that I can get out of this, that I promise I would live a better life. I would promise that the next time I'm sitting in my deathbed, I would be able to answer that question and say, yes, I did make a difference. And so the past few years, ever since I made that transformation, I've dedicated my life to trying to help other patients, to helping people. It even manifested itself into opening a gym here in Alameda, California, where I live, where it's called the Mission HQ, the Mission Headquarters, where our primary mission, we have our regular boxing classes, our high intensity classes, but all of the fees that we charge to do that goes towards our main mission, which is providing training, free training to people that are chronically ill, people that are elderly. They all get to train for free. And the stories that we hear from them is such an amazing thing. And it's so inspirational to see so many people make their transformation, do all these changes. And it's not even about the physical aspect of it. It's about the confidence that they get from the physical activity. Being able to walk to the grocery store and being able to, I had one of the patients fall down one time, but she was able to brace herself. One patient got her diabetes in line, and they get coaching for food. They get all of that, and that's all for free. And I've dedicated my life to helping as many people as I can, especially with all of those things. So, the message that I have to these patients when I talk to them is that if you can move an inch, you can move a mile. It doesn't matter how slow it takes you, doesn't matter how long. If you can move an inch, you can move a mile. And I go, how do you walk 10,000 miles? You don't think about the 10,000 miles. You just start taking your first step after step after step. And it's not a matter of if, it's a matter of when. That's my message to all the patients that I work with, all the kidney patients that I talk to. Yeah, that's my question. Hopefully the video, but if not, that's okay. We'll send out the link.
Okay, thank you so much, Wilson. We have to wrap up, but if I may, could I have a question to Wilson and also one question to Shuchi? Wilson is, how can we as a healthcare provider communicate better to you, our patient? As you said, you were advised to lose weight, but you just put it off. There's got to be something we didn't do right to get the message to you. Look back, what do you wish we say? Or is it better we have a patient or a mentor like you to directly talk to them instead of a healthcare provider talk to them? My question to Shuchi is that from technical point of view, do you think ultrafiltration itself contribute to the muscle fiber loss? Like Chris McIntyre's study on large ultrafiltration has damage to the heart, to the brain, to the guts. Maybe when we ultrafiltration too much, we are damaging their muscle fibers. Maybe they will have higher CPK after each dialysis. We have 2 minutes to answer all those questions. Sorry.
Yeah, I'll keep mine brief. To answer your question regarding reaching out to the patient is yes. Right now I firmly believe that having another patient speak to another patient is much more effective. Now, when I speak to other patients, I may speak with them with their nephrologist or their physician there, and I'm saying the same thing, but they're listening to what I'm saying because they know that I've gone through what they've gone through. And doing like what we did today, where I can give the anecdote part of it, and Dr. Young comes in and gives the scientific part of it. It all kind of works together and works very well.
Great.
Yeah, I think, Cesar, it's very possible that dialysis, stuns the muscle, as just like we know on echocardiogram that it stuns the heart. And so I have no doubt that we are putting many roadblocks in our patients' way, especially when they're on dialysis. And that's why our study was focused to start them pre-dialysis to help them condition essentially for dialysis. But I just, I think that one thing that we're missing is how big weight loss is important, but that sometimes can be very hard goal to reach, and sometimes we can't reach it. But there is this concept of metabolically active fit people, like metabolically obese fit people. So we just need to get people moving, and that's something that we can incorporate into our practice. And just as much time as we spend on blood pressure, perhaps we should also be spending on exercise, because it's likely to have similar effects on our health.
Great. Thank you so much. And we will end with this high note, and we'll be back at 12:45. Thank you.
All right. Thank you.
Shuchi and Wilson for dealing with all of our tech glitches we had today. If you guys can stick around for a few minutes, so there's a lot of comments in the stage chat and questions for both of you. So if you can kind of mosey over there for a few minutes and maybe answer some of those questions, that would be great. Thanks so much, everyone.
Thank you.